Good evening. Today my topic is prospective observational study on ocular manifestation in IBD. So IBD is of two types: ulcerative colitis and Crohn's disease. These are mainly immunomediated mechanisms, that is dysregulation of the innate or adaptive immune response directed against the luminal bacteria in the intestinal lumen, and changes which causes the changes in the intrinsic barrier function of the intestinal mucosa. And there are many extraintestinal manifestations like in joints, peripheral or axial arthropathy. In skin, there are symptoms like erythema nodosum, pyoderma gangrenosum, aphthous stomatitis. And in eyes, we have seen the episcleritis, uveitis, hepatobiliary tract involvement. And the prevalence of the extraintestinal manifestations varies from 6 to 47%, which is seen more commonly in the Crohn's disease than ulcerative colitis. And ocular extraintestinal manifestations is found in the IBD, which ranges from the 0.3 to 13%. In ocular extraintestinal manifestations, there are different findings like the conjunctivitis, episcleritis, scleritis, marginal keratitis, anterior-uveitis, retinitis, retinal vascular occlusive disease, optic neuritis, or orbital inflammatory disease. In our study, our aim is to find the is to determine the prevalence and types of ocular manifestations in IBD. So we have taken the 80 patients and 160 eyes were included. Informed consent were taken from the patients. Ethical clearance was obtained, and this was a prospective observational study which was performed over a period of 1 year. We have excluded the patients who were unwilling to participate, or those having the cataracts, and those having the ocular or any systemic diseases like diabetes, hypertension with posterior fundus lesions. We have done the visual acuity with Snell's chart, slit lamp examination for the anterior segment, and then pupil was dilated with tropicamide phenylephrine, and fundus examination with direct ophthalmoscope, slit lamp bimmerscope with 90D, and indirect ophthalmoscopy was done. In our study, we have found that the distribution of the IBD was more common in the age group of 21 to 30 years. Mean age was 32.5 years, and these IBD patients were more common in the males in our study. 67.5% were male, and 26%, that is 32.5%, were females. And in our study, 60% of the cases was ulcerative colitis, and 40% cases were of Crohn's disease. In this chart, we have shown that in our study we have found the episcleritis with 7.5% prevalence, which was the most common findings, and there was anterior uveitis with 5% prevalence, and scleritis with 1.25% prevalence. So total prevalence of the ocular manifestation was 13.75%, and 86.25% of the eyes were normal. We have seen also that even if the ulcerative colitis patient was more, but the prevalence of the ocular manifestations was more in the Crohn's disease than ulcerative colitis, where Crohn's disease having the 9.38% prevalence and ulcerative colitis having 4.38% prevalence. So there are a few studies like Bandyopadhyay et al. This study also shown the 30% of the ocular manifestations in the IBD patients, where 9 patients was the episcleritis and 7 of them was uveitis in case of the 120 IBD patients. There are other studies like Manser et al. This study also shown the 12.3% of the extraocular manifestations, like ocular extraocular manifestations. And this study also suggested to use the early mesalazine therapy, which is a protective factor against the development of the EIMs. And Eisen et al. Study, this study was done in the Europe. They have found a little less, like 0.9% anterior uveitis and 0.2% episcleritis. So our study has the similar findings with the Indian studies. So in conclusion, we have found that the ocular manifestation may be associated with serious vision-threatening complications. So IBD patients should be educated about the symptoms of the ocular complications and advised to seek the ophthalmic care promptly. So these are my references, and thank you.
The comment is that your slides were too busy, so it was very difficult to go through the text. Yeah.
So what is the most clinical manifestations? Ocular manifestations.
Ocular manifestations. Ocular manifestations was episcleritis, scleritis, and anterior uveitis mainly.
Most common.
Most common episcleritis. Most common findings was episcleritis.
What type of episcleritis? Is it diffuse or nodular type?
Most of the cases was diffuse episcleritis. Few of them were nodular also.
Because it is the most commonest finding, so we have to clarify the
अच्छा,
what
diffuse
type of
nodular or
vasculitis
हाँ,
is
हाँ,
very important.
okay sir.
Thank you.
Okay sir. Thank